the weather into that warming season during the winter. So that's very, very exciting. In addition to how we're going to operate the Cannon shelter differently after this warming season, we will hopefully at some point in 2021 transition our healthy shelter at Mission into a bridge housing model shelter. And that is a shelter which offers help for people who have decided in their time that they want to get out of homelessness and they are ready to be connected to services. And that will be a facility where people can get stabilized, whether it's 30, 60, or 90 days at a time, be connected to the types of services that will be able to sustain them, stabilize them so that they can get jobs and then permanent housing. And Salvation Army will be running the regional shelter for bridge housing. They're operating the West Mission shelter right now for healthy sheltering during COVID. But as I mentioned, hopefully sometime, we don't know when, but in 2021, it will transfer to that bridge housing. And we've been meeting regionally weekly now on that project with the city of Spokane, the city of Spokane Valley, and the county. And we've made great progress in that as far as agreeing to what we want our homeless shelter to look like as a region. Because I've been, very clear, Spokane, our homelessness is not just a city of Spokane issue, it is a regional issue. And for the first time during COVID, we've been able to bring our regional partners together to work on this and fund this together. So that's very, very, very exciting. So I think that's about all I have right now. If anybody has any questions on the shelter or the new system, the plans that we have, I'm definitely ready to take some questions.
If I could, I was wondering, so right now the Mission shelter is an overnight shelter. Will it stay that way through the winter and serve as an effective warming center? So it'll be Cannon and Mission would be the two city-owned or city-run shelters, right?
Well, the Cannon is the city-owned shelter, and then the West Mission is the regional shelter, and that will, yes, be a night-by-night emergency shelter during the winter months, yes.
And are there any other city-owned or city-operated warming centers in the works?
Yeah, within the system, there are other locations that the city helps to fund, and there are also those private nonprofit providers as well. So the system also includes partners that we've worked with while we flexed before Cannon opens to offer more beds when the weather turned cold. So Truth Ministries is a partner that we work with. The city helps to fund. Catholic Charities, of course. And then Union Gospel Mission has also flexed many of its beds. They usually have about a dozen beds that they make low barrier so that people can access help wherever they need.
So then you'd say this year, in past years, there's been some rocky winters when it comes to centers. So you'd say this year you're pretty confident that things are going to go smoothly?
Absolutely, they've gone smoothly so far. We've been able to flex the regional shelter system and have had capacity every single night. So that's very, very encouraging. And then bringing on even more beds at Cannon, initially 60 and then eventually 80 more beds will be a huge help. I think the biggest change though we'll see is when Cannon becomes that 12-month shelter. So it provides us even more flexibility. In the summertime, it'll be the day shelter, but then depending on the weather, since we have the same operator, we can change it to transition very, very quickly to a warming center overnight. So I think that will alleviate any issues that we've had in the past as far as being able to provide those kinds of services during the winter.
I'll ask just more before I let other people jump in here. I was also just curious about with the governor's new restrictions this weekend. I was wondering if you think, simply put, he made the right call.
Oh, so you're pivoting to a whole new subject.
Yes.
Well, can we talk about the shelter system first? And then if you want to ask me questions about something else, would that be okay? So I don't go back and forth.
Absolutely.
So if anybody else has any questions regarding the regional shelter system, I'll be happy to take those.
Yeah, Mayor, it's Adam with the Spokesman Review. I'm just wondering, and forgive me if I missed this, but it's beginning in June 2021. Is there an agreement or template in place for how that will be funded? Is it a regional approach again? And is there anything set in stone right now?
Nothing set in stone right now. So we're continuing to have those conversations. And like I said, we meet weekly about that. So right now, just trying to identify where dollars might be for that on the city's side, but also continuing to have conversations with the region on what that funding will look like moving forward.
And only 2 of the 3 bays will be open when the shelter opens later this week. What are the amenities? Like, I'm assuming there won't be bathrooms immediately. What are we doing in the interim?
Yeah, we're going to have porta potties like we've had in the past. Those are coming in. We also have a shower trailer that we had ready to be used at the Mission facility that we didn't end up using there, but those are as a trailer with 6 individual showers, and so we'll have that on site. But the good thing is that 3rd bay with the showers and the restrooms should be operational within about 3 weeks.
And I know some folks with the health district sort of warned to the city council last week that we're beginning to see COVID spread in the shelters. Are you concerned about that? And is there anything the city can do to sort of help mitigate the spread in addition to what it's already doing?
Yeah, we have been very fortunate that up until now, we have not seen much spread of COVID in our shelters. And I have to commend the Spokane Regional Health District for that. They have an incredible outreach group that goes into the shelters daily and does assessments, takes temperatures, and if anybody is showing any kind of sign, they get them to medical help or even to isolation or quarantine if they need to. I think the Family Promise latest outbreak that you mentioned, they're quarantining and they're doing what they're supposed to be doing to make sure that they're not that there's no risk for any more spread there. So I think as long as we continue to do our due diligence and do the work that we've been doing with the regional health district, I think we're going to be okay.
And if I could just, to circle back to sort of old history now, you were pretty critical during the campaign last year of the plans for the shelter on East Sprague and talked about low barrier shelters and comparing it to just warehousing people. And what I hear about the Cannon facility and plans for it strike me as, in a structural sense, very similar to the plans that were out on East Sprague and that you criticize. I mean, to you, what's the difference?
A lot of differences. So number one, we're doing this very regionally. This isn't something that the city of Spokane is doing on its own. We've engaged our regional partners because, as I mentioned, this isn't a city of Spokane issue when it comes to homelessness. This is everybody's issue. So the regional collaboration is huge on the decisions that are made, on how things are being funded. So that's huge. The Cannon Street shelter now, when we begin the 12-month operations of that, is really going to be a facility that will be an intake into the system that has accountability in it. And when I say intake, the Cannon Street shelter is where people will initially go, whether it's the day shelter during the summer or the warming season shelter in the wintertime. And that's where people, even in that setting, will have an opportunity to access help. And when they come to a place where they are willing to accept the resources and the services that are available to them, then they can be referred to the bridge housing model. And that's what I'm so excited about, is that's where people will get help 30, 60, or as I said, 90 days, where they'll be stabilized so that they can get a job and get into permanent housing. And that's what we haven't had before. So I'm very excited about the type of system that we've created regionally for Spokane County.
Thank you. I have a couple of restriction questions too, but I'll hold off.
Okay, sure. Anybody else? Okay, bring on the restriction questions.
Adam, you can go ahead and go first.
Oh, geez, I thought you would go first.
I'll start with a simple one then. I mean, do you think, weighing the economy here and the case numbers that we're seeing skyrocketing, that the governor made the right decision?
I think the governor did what the governor felt that he had to do, and our cases have increased, not just in Spokane County, but across the state. My effort right now is to help those who are impacted. We have to protect our most vulnerable. We have to get our cases down. Very much agree with the governor on that. It's alarming how high our cases have gotten. But also offer support to now the businesses that are really going to need help, because here we are again where we are restricting their ability to keep people working and to keep their doors open. So that's where a lot of my effort is going to be. We're looking at ways that we can offer assistance to them. I'm also meeting with the new public health officer, the interim officer, Dr. Frank Velasquez, later on this afternoon to start having some discussions with him and with Amelia Clark. Reached out to both of them last week so that we can have those discussions. And again, like I said, regionally coming together again. This is what I think we need more than ever at those Tuesday health district meetings in the morning, is our regional partners, all of us together, talking about how we're going to get through this and on the other side of this, making sure that those who are vulnerable are protected, and also making sure that those businesses that are impacted with these latest restrictions are getting all the assistance that they need as well.
It seems like pretty much everybody agrees that more money needs to come from somewhere if these businesses are going to survive a new set of restrictions. Where do you think some of the places that money could be found are going to end up being? Where do you think that money should be coming from?
Well, the state just mentioned over the weekend that they have $50 million earmarked for this effort. I don't think that's enough. I think at the federal level, we're going to have to see some assistance. I plan on reaching out right away to Congresswoman Kathy McMorris Rogers. I think that's where the bulk of the money is going to come from, because I don't think the state of Washington has it. Through the CARES Act money that Spokane County distributed, 10 million of it recently went to the hospitality industry, and I think that was just to get them whole up to now. They're going to need more assistance now that we've got tougher restrictions on them. So hoping that will come from the federal level.
Great.
Mayor Adam again with the spokesman. If I recall correctly, librarians were sort of used to help navigate for businesses the grants and such available to them. Are there things like that the city can do again now that we're sort of back in this situation?
Absolutely. We're in discussions right now about how the city can help businesses, and we'll have an announcement later on this week on some of the things that we've come up with. Definitely one of the easiest things that we can do now that restaurants are going to have to rely on takeout if they can't be outside. I can't imagine that they can be outside in this weather. Is that Order Up Spokane, social media campaign that we had back in March. Who would have thought that we're almost into the holidays and we're reviving that? But that's what we'll do. We'll do whatever we can and whatever we have to make sure that businesses stay afloat during one of the busiest times of the year, during the holidays.
I made the terrible mistake of checking Twitter on a Saturday night. And I noticed that you were sort of expressing some frustration after a night of meetings. And then it seemed like on Sunday you were a little bit more measured in your official statement. Can you just sort of walk me through that weekend for you and what your reaction was and what you were working on?
It was a busy weekend for sure. Lots of meetings, lots of real unknowns until we heard from the governor on Sunday. I don't know if I had frustrations on Saturday. I had a lot of questions. And I think my tweets reflected questions that I and a lot of other people had. A lot of those questions were answered Sunday morning. And so thus the response a little bit, more calm, because we had answers to questions. But again, we have to have the conversation of getting what we have to do to get these cases down, what we have to do to support our businesses. And again, following public health guidance and protocols of masking and social distancing and keeping gatherings to just our households. Everything that we can do, we have to do to make sure that this case count comes down.
I promise this is the last one. I see like yourself and a lot of others sharing those same questions. But I guess if action isn't taken, what is the answer? What's the path forward to reducing case counts, if not through action like reducing indoor gathering and, putting restrictions on dining and that sort of thing again?
That's a tough one. I mean, the thing that we can do right now is to adhere to the public health guidance. That's what we have within our control. So much of it is out of our control, right? And so we know that we can wear the masks. We know that we can social distance. We know that we have to have holidays. The holidays are going to look a little bit different, but that's what we absolutely have to do. It's on us to do this, not only for ourselves, our families, our friends, but our communities. And we're going to be tasked with that even more so. One of the statistics that came out of the news conference yesterday, that Washingtonians are masking at 97% rate. That's incredible. We need to keep that up. If that's what it's going to take to get these cases down, we need to continue to do that.
Mayor, this is Doug from Public Radio. A lot of Republicans in the legislature are talking again about a special session and finding money for restaurants and that sort of thing. Is that something that you would support, another special session before January?
I, have been in discussions with the state lawmakers about that. I don't know if that's something that they can do that quickly. January is going to be here before you know it. I don't know how realistic it is that a special session will actually happen. Anybody else? Hey, one thing I wanted to let you know, we wanted to have this news conference at the Cannon Street Shelter, but because of the restrictions, we decided to do it on Zoom. But we do have through Cable 5 a video that Jeff Humphrey just did on the Cannon Street Shelter. So if you need video and you can see the transformation that facility has taken in the last several months, it's on our website, SpokaneCity.org. So what's that? Oh, there'll be a link in the release. There you go. I was just told. So that'll help you out a little bit. And again, hope to have that open by this weekend. This week's weather a little bit mild, but by the weekend, it's supposed to get back down into the freezing temperatures overnight. So we'll have it up and ready by then.
Thank you.
Yeah.
Thanks, Mayor.
Thanks for joining today. We'll talk to you later. We'll let you know what we're doing to help the economy during these restrictions. Bye, everyone.